संत ज्ञानेश्वर शिक्षण संस्था's Honorable Shri Annasaheb Dange Ayurved Medical College Postgraduate Research Center Ashta. I welcome Dr. Mahesh Patil sir, who is a guest speaker for today's session. As you all know, we are arranging for this organ donation campaign several events right from Wednesday, like reel making, essay competition, extempore, rangoli, painting competition, also the street play and rallies. So today's session is of guest lecture by Dr. Mahesh Patil sir. I welcome you all the students, and I hope you all will enjoy, and we are very privileged to have Dr. Mahesh Patil sir. I would like to give his a short introduction. Dr. Mahesh Pandurang Patil, who has done his bachelor's degree in Ayurveda, that is BMS from Gomantak Ayurved Mahavidyalaya and Research Center, Shiroda, Goa. He has done his post-graduation degree in Ayurveda Rachna Sharir from National Institute of Ayurveda, Jaipur, Rajasthan, very renowned institute. And right now he is serving as a PhD scholar in our institute, Honorable Shri Annasaheb Dange Ayurved Medical College. He is serving as an associate professor in Department of Rachna Sharir in Gomantak Ayurved Mahavidyalaya and Research Center, Shiroda, Goa, from September 2012 till date. He is also an organizing committee member international in seminar Jara, August 2018 by Gomantak Ayurved Mahavidyalaya. He is also organizing committee Clinicon 2023 National Seminar on Clinical Approach to Ayurveda, March 2023 by Arogya Niketan and Sri Ayurveda in association with Sarthak Foundation. He has guided many students for paper and poster presentation in national and international conferences. Goa State Directorate of Technical Education Admission Committee member he was in 2020 and 21. He is member of NABH committee as well. He is in charge of Red Ribbon Club of Gomantak Ayurved Mahavidyalaya and Research Center, Shiroda, Goa. And I am very much privileged and thankful to him that he has been graced our institute by having an online guest lecture. Sir, you can proceed. I'll make you host.
Okay, sir. Thank you.
Yeah. You can share
Respected Subhash Patki sir. ऐकायला येतं ना सर?
Yes, yes, sir.
Respected Subhash Patki sir, Dr. Sarfaraz sir, other teachers and my dear students. Good morning to you all. First of all, thank you to ADAMC Ashta College for giving me the opportunity to speak on this topic and inviting me as a guest lecturer for today's lecture. And thank you very much for giving me, this is a very nice opportunity to share my views about this topic. I will be talking in mostly in English, but sometimes in between I will be sharing my views in Marathi also, so that it will be easy for you all to understand the topic. I hope you will like the lecture. I will share the lecture now with you all. Okay, can you see the PPT?
Yes,
sir. Okay, thank you. So, my topic for today's lecture is organ donation is importance and process. Okay, as sir has already given my introduction, I am the PhD scholar of your own institute and presently working as an associate professor in the Department of Rachna Sharir in Gomantak Ayurved Mahavidyalaya Research Center, Shiroda, Goa. Today I'll be talking about organ donation, and you will learn or you will know today all about organ donation, what is the process of organ donation, and what is the importance of organ donation. Okay. So we will go step by step. Okay. Learning first, what is organ donation? So organ donation is the process by which a healthy organ or tissues are removed from one person, which we call as the donor, and transplanted into another person, which we refer as the recipients whose own organs have failed. Means the person, because of any disease or any ill effect or because of some accidental cause, if the organs are not working properly, if they have failed, then he receives the organs from the donor, so that the normal functioning of the body will be continued. Okay, so that person is called as recipient. So the organ donation is done when the organs of the person have failed or not working properly. Then there is a need of organ donation. So there are two types of donors, okay, which can donate the organs. Okay, there are two types: living donors and deceased donor. The living donor, that is the first category, are the person who are not are still living, means which are not dead. Okay, so it is possible for the living person also to donate the organs, few organs from his body like kidney, part of the liver, etc. And second category is the deceased donor. So deceased donor is the someone who have just died, or the person who has declared as the brain dead. Okay, the brain death means brain is stopped functioning, but the other organs are still functioning somehow. Okay, so such person are called as the deceased donor or brain dead person. So the family members of that deceased donors can uh, donate the organs of the brain dead person or the person who has just died, so that it can be donated to the recipients and the functioning of the other person or recipient can work normally. So, in living donation, a living person volunteers to donate its body organs like kidney, a segment of their liver, lung tissues, or other transplantable tissues like skin, part of the skin, etc. Okay, but it is only done after following rigorous health and psychological evaluation of the donor. Okay, the donor must be physically fit. There are many tests which are conducted before allowing him to donate the organ, and he should be also physiologically fit. Means for that physiological evaluation is also done. Then only is allowed to donate the body organs. The deceased donor donation means the person who has just died because of some accidental death, or who is declared as a brain death, or in some jurisdiction after circulatory death. Okay, there is a different type of death which is called as circulatory death. In the circulatory functioning of the body is failed, and but some organs are normal intact. So in such cases, the organs can be donated. Okay, so there are two types donors which are there in the society, that is living person and the deceased person. Okay, so what are the organs which can be donated? Okay, the most commonly transplanted or donated organs are kidneys, liver, heart, lungs, pancreas, and intestine. Okay, these are the most commonly donated organs, out of which kidneys and livers are the most common which are donated in India. Then apart from this organ, the tissues like corneas from eye, skin, a part of the bone or few bone, heart valves, or the blood vessel can also be donated. Okay, these tissues can dramatically improve the quality of living person, means the recipients, and can give the sight to many blind people. Okay, so not only organs but tissues are also donated. Okay, so there is mostly we know that only kidneys or the heart are donated, but along with these organs, the other tissues like skin, tendons, cartilages also can be donated nowadays. So, what is the process of the organ donation? How organ donation works? Okay, there is slight difference between living donation and the deceased donation, but main thing or the main procedure is almost same. The organ donation transplantation is a complex process. Okay, it is not like that we'll go directly in the hospital and we'll say, okay, I want to donate the organ. So it doesn't work like that. Okay, the process starts with the donation and ends with two surgeries. Okay, for the donor person and the recipient person. Okay, and the organs from the donor person is taken and it is transplanted and uh, placed into the recipient person. The steps in between take place within a very short window of time. Okay, mostly it will take within the same day. Means it will take the process will take is completed at in the same day. So for the living person, the steps like donor identification, obtaining consent, medical assessment, matching donors to recipients, coordinating the transplant, recovering the organs, organ transplantation. These are the steps. Okay. So what are the details of this step? Okay. First, the donor identification. If you are of legal age, means 18 plus, okay, you can voluntarily decide to donate the organ. You have to inform the state board or the national board of the organ transplantation. There is a separate board. I will come to that point afterwards. Okay. So once we are decided, there is a detailed identification of the donor is done. Then obtaining consent. This is the second step, which is the important step. Uh, the legal age is important in this case, because if you are willing to donate the organ, so that decision should be done if you are above 18 years old. So the consent is obtained from the person. Then the legal advice, the legal procedures are there, which are done by the organ procurement organization. Okay, that they will follow the all legal procedure for this obtaining consent. Then next step is the medical assessment. Okay, this is also important step. In this, the detailed assessment of the donor is done. Okay, there are many tests which are performed on the donor. Not only physical tests, but the psychological tests are also done to evaluate its psychological stability. Then medical tests, blood tests are also done, ECGs, then HIV test, everything is done. Hepatitis test is also done. And if it is fit for donation, then only the donation process is continued. Okay, so these are done to ensure that the donor is fit for the donating the body organs. Okay. Then next is matching donors to recipient. Okay, so anyone cannot donate the organ to anyone. Okay, there is some procedure which is done. Means after the blood test, after the tissue compatibility test, it is matched with the recipient person. Okay, the recipient's blood, recipient tissue should match with the donors. Then only the organ transplant is successful. Okay, otherwise the organ transplant will fail, and there is no use of organ donation or organ transplant. So to ensure that the donor and the recipients are matched, so that the organ transplant is successful. Okay. For that, the recipient is also undergone with different medical tests. Okay. Blood test, everything is done on the recipient also, so that the match of the organ should be done with the recipient. The next is the coordinating the transplant with the means the donation and the recipient, donor and the recipient, they are coordinated. Means the recipient is prepared with the surgery. Okay, suppose the recipient is not in the same state, or that far from away from that place where the donor is living, or from the donor's hospital. Okay, then the authorities will inform the hospital close to the recipient's organization, and they will prepare the recipients for necessary transplant of the organ. Okay, so this is the coordinating between the transplant. Means the organ from the donors is sent to the recipient's hospital, so that after preservation, okay, the preservation process will be also shared with you in the next slides. Okay, I will explain how the preservation process works. So this is the coordination between the recipient hospital and the donor's hospital is also important, so that they should prepare for the surgeries. Okay. Then recovering the organ, the surgery on the donor is performed, and with the proper medical assessment under medical supervision, everything. Okay, the medical team will receive the organ, will take out the organ from the donor, and that is transported with proper care to the recipient's hospital. Okay, and then organ transplantation will take place. Okay, when the once the organ arrives to the recipient's hospital, the recipient undergo pre-operative preparation before transplant. The surgeon will implant the donated organ during the surgery, reconnecting blood vessels, ducts, etc. Then immunosuppressive therapy is started on the recipient, so that the recipient body should not reject the organ. Okay. Then after that, the post-operative care is done, and then the recovery of the patient will start. So this is the process in the living person. Okay. The detail about the organ donation in the deceased person. Okay, it is slightly different, but most of the steps are common. Okay. So first is donor's referral. Okay, the hospital will with intensive care units. Means the person who, suppose the deceased person or the person who is on the verge of the death or who is declared as the brain death. Okay, in that hospital, the hospital authority will inform the procurement organization, which is called as OPO in short, uh, about the death of the person or the death of the patient or brain death, or if he is willing to donate the organ just before the death, then they will inform those organizations, and then the process will start. Okay, first will is the after the death, means after the brain death is a confirmation of the death. So in this case, okay, in the case of organ donation and in the case of brain death, the two independent physicians are required to examine the patient and confirm the irreversible cessation of brain function. Means they have to declare the brain death. Okay, one physician is not allowed. Minimum two independent physicians are required so that they can both declare that the patient is brain dead. Okay, then only the organ donation process can be started on that patient or on that person. Next is authorization for donation. Okay, the OPO, that is organ procurement organization, will discuss donation with the family. They will inform in detail about the process of the donation, what are the requirements of the uh, process of the donation. They also verifies donors registered status. Okay, if the person or the patient who has just died, he has registered himself at the state authority or the national authority willingly to donate his organ before, then they will also verify that registry. Then they will check the registry if it is properly registered. If not, also if the relatives, okay, after brain death, they are willing to donate, okay, before previous registry also, if they are willing to donate the organ, then only the other process of the registering the patient is started. Then the next step, that is the clinical and laboratory evaluation. Okay, even after death of the person, the comprehensive test ensures organ viability and compatibility. Means if the person who has just died or you declare brain death, their organs, if it is viable, they are compatible, to check that there are different tests which are done on the person, and to ensure that the organs are suitable for donating and the organs are intact so that they can be properly transplanted into other person, that is to the recipient. Okay? That evaluation is done with the clinical and laboratory tests. Then next is the allocation and matching. Okay, as I said that there is a regional registries or national registry which maintain the list of the recipients. Okay, there is a list at the national level also, at the state level also, in which there are a waiting list for the of the patients who are uh, whose organs are failed or organs are not working properly and they require organ transplant. The list is there with the authorities. They will check the list so that the suitable donor is uh, find out suitable donor is find out, and then the allocation and matching of the organ is done. As I said, the organ cannot be donated to any person. There should be a proper match between the donor and the recipient. So the match is done, and the list, the person is selected based on the blood type, tissue compatibility, and also urgency. Suppose the person who is on the top list is uh, organs are can be functional for few more days, and person who is on the lower list after 5, 7, 8 or 10 waiting list, okay, but he is in urgent need of the organ. It means he cannot survive more days without organ transplant, then that person is selected. So urgency is also a criteria for selecting the recipient. Okay, this is also important criteria. Then geography also. If the recipient is staying close to the donor, then is preferred compared to the person staying far away, because the organs has to be preserved and it is transported. So that time, till that time, the organ is received to the recipient. Till that time, the organ should remain intact and viable. So the geography or the distance between the donor and the recipients, or the time taken for carrying the organ from donor to the recipient is also considered. Okay, it should not be like that the person is urgent need in the organ and the person is staying very far away and require more than 2 days 3 days to transport the organ after proper preservation, then it is no use carrying organ till that to that person, because the organ will not be intact, will not be viable till it reaches to the recipient. So depending upon the geography also, the patient is selected. Then the match is done with the help of blood test, tissue compatibility, and the recipient is selected. Then surgical procurement means from the donor. Okay, this is the steps on the donor. So multidisciplinary teams will retrieve multiple organs simultaneously. Okay, the few team will receive, one team will take out the cornea, one team will take out the lungs, heart, other team will take out the uh, kidney or liver, etc. So this is done simultaneously so that the organ can be removed quickly and it will remain intact for longer time. Then organ preservation. The organs are promptly cooled and perfused with specialized preservation solution to mitigate cellular injury. Means once the organs are removed, okay, they are tend to get damaged, they tend to get injured. So to prevent that, the organs are preserved in proper solution which will mimic the intracellular fluid environment. Okay, the organs are preserved and stored in such a way that they are equal to the body uh, environment, okay, inside the body, so that they can be stored for a longer duration of the time. And after proper preservation, the logistic coordination is done. Means the transport team will ensure the timely delivery, because this is very important. If the organ delivery is delayed, the organ will be damaged, and this is no use for transporting, means no use for transplanting to the other person. So the transport teams will ensure that the organ is delivered on time. And next is the transplantation post-operative care, is in the same as the living person donating the organ. The surgeon will implant the organ, and multidisciplinary teams manage immunosuppression, monitor graft function, and also will support the recovery of the recipient. Okay? It is also important because the person's body should not reject the organ. Okay? For that, the immunosuppressant medicine are given to the recipient, so that the body should not reject the organ which is received or which is implanted in that person. Okay? So the post-operative care is very important in this case. Now, how the organs are preserved? Okay, the preservation techniques. Once the organ is taken out from the donor's body, there is a process by which the organs are preserved. Okay. This is done so that the organs which are vulnerable to ischemic injury because of the lack of oxygen and nutrients, they can tend to get damaged. Okay. Inside the body, there is a continuous supply of the oxygen, continuous supply of the nutrients to the organ. But once it taken out from the body, the oxygen supply, nutrient supply is stopped. So to prevent that, the organ preservation are done so that the organ viability or intactness of the organ is maintained. Okay. So the first and the oldest method which is done previously, that is called as static cold storage, okay, which is called as SCS. So the organs are flushed with cold solution which is at the 4 degrees Celsius. Okay, and then the organs are stored on ice. This method slows down the cellular metabolism by reducing oxygen requirements and preserving tissue integrity. Okay, so since the organs are stored at the lower temperature, the oxygen requirement and the tissue damage is slowed down by this process. Okay, this is very simple method, very cost effective, and is widely used mostly in the kidneys, liver, and pancreas. In the olden days, this is the most preferable technique which was used. Okay, because it is a cost effective, simple, and as in India, the kidney and the liver transplant is at a higher rate. So this preservation technique is widely used. The second, the slightly advanced and slightly costlier technique is the hypothermic machine perfusion. Okay, so in this method, a machine is used which pumps solution through vasculature of the organs. Okay. It provides continuous nutrient delivery. It removes waste products from the organ and it improves outcome in marginal or extended criteria organs. Okay, means the organs can be stored and preserved for a longer duration time compared to the static storage, because there is a continuous supply of the nutrition and the oxygen with the help of motion. This is slightly costlier method, but it extends the life of the organs. Okay, the next and the most advanced technique is the normothermic machine perfusion, called as NMP. So in this, the organs are perfused at body temperature with an oxygenated nutrient-rich solution which mimic the physiological condition of the body. Means the organs are perfused at the body temperature, okay, not the lower temperature as in the static cold storage, but in this there is a continuous supply of the oxygenated solution which will improve the condition of the organs, okay, in the outside the body. This allows real-time functional assessment and potential therapeutic innovation of the transplant. Before transplanting the organ, it allows the assessment of the organs. If the organs are properly functioning or not, it can be assessed with this method. So if there is organ which is not proper functioning properly, the medical intervention can be done in this method. But this is a costlier method, but and it's not used widely. Okay, the most commonly used method is the static cold storage method. Okay, so this is the way the organs are preserved. Okay, so what are the chemicals which are used for the preservation? Okay, before that, okay, this table will show how the two method, that is static cold storage method and the machine perfusion, will affect the organ viability, or it can extend the organs storage. Okay, for example, in the static cold storage, the heart can be stored for up to 6 hours, 4 to 6 hours. But if done with the message perfusion method, the same organ, that is heart, can be the viability of the organ can be extended up to 8 hours. It can be stored up to 8 hours. Lungs can be stored up to 12 hours by the machine perfusion method. And same liver, which can be stored for up to 12 hours by static cold method, can be stored up to 24 hours by machine perfusion method. And pancreas can be stored same up to 24 hours by machine perfusion. Kidneys can be stored up to 48 hours, and intestine can be stored up to 24 hours by the motion perfusion extension method. Okay, so this is one of the best method by which the organs can be stored for a longer duration. So if the transport facility is not proper, then also it can be stored for a longer duration, and can be transported for the distant person or recipients. The chemical used which for the preservation, okay, the solution which are used, okay, they make the environment around the organs like the intracellular environment. Okay, they mimic the intracellular environment, and it will counteract the injury which take place during the organ removal from the donor. Okay, the most common solution which is used is called as University of Wisconsin solution, or called as UW solution. Okay, it is considered the gold standard solution. This solution, that is UW solution, uh, is an intracellular type fluid with low sodium, high potassium, and also mixed with the antioxidant. Okay, it minimizes cell swelling and oxidative damage. Okay, the cell swelling which can be caused while removing the organ, and the damage which can cause the after oxidation process, it reduces and slow down that process of damage to the organ. The second solution which is used, it is histidine tryptophan ketoglutarate solution, is also called as custodial HTK solution, which contain histidine for buffering capacity, tryptophan for membrane stabilization, and ketoglutarate for energy support. It is very effective in heart, okay, for preserving the heart, and also abdominal organ preservation. Okay. The next solution which is used is choline solution, or also called as urocholine solution. It is a early preservation fluid with high potassium or magnesium, phosphate, sulfate, and glucose concentration. It modified the original solution which was used in early days. Okay, this is the solution which is used in the early days before the University of Wisconsin solution. It is now modified so that it improves the stability and it is extended in the cold storage method. Okay. Then the next is the Celsior solution, which contain mannitol as an osmotic agent, glutathione for oxidant as an antioxidant, and also contain balanced electrolytes. Okay, this is mostly used again in the heart, lung, liver, and kidney graft. Okay, when the kidneys, heart, or the lungs or liver are transplanted and transported, this solution is used in those organs. Then next is the low potassium dextrin glucose solution. It is mostly used in the lungs because it reduces thrombosis. Okay, there are chances of the thrombosis which can take place in the lungs after removal. So this solution prevent the thrombosis, and that's why it is widely used in the lungs. Okay, the other solution which are also used consist of growth factor, anti-inflammatory agents, gene therapy. So these solutions are also mixed with the other solution to improve the lifespan of the organ so that they can be preserved for the longer duration. The evolution from early hypothermic techniques to dynamic perfusion with this using chemicals, okay, improves the lifespan of the organ which are removed from the donors. Okay, so this is also improves the chances of the successful transplant to the recipient. Okay, so there are new chemicals which are coming nowadays, but these chemicals are widely used. Okay, then the what is the importance of organ donation? Okay, so the global shortage of donors or the organs have profound human and social implications. Okay, the organ donation not only rescues life but also alleviates long-term healthcare burdens and foster collective compassion. As said, a single deceased donor can save up to 8 lives. Okay, means a single person who is donating organ can save the lives of the 8 people. Okay, and along with them, it can improve the quality of the life of 50 more people through the tissue transplant. Okay, like cornea, skin, bone, intestine. Okay, it can improve the functioning or the life of the 50 more person. Okay, you can imagine. Okay, the giving life to 8 people and improving the 50 more people their life. Okay, their burden. So it is a great thing of like means organ donation. Okay, but as I said, numbers. Okay, organ donation is more than just numbers. Okay, it's not about improving the life of 50 people or saving the life of eight.
Sorry to interrupt you, sir. There is only
Uh,
1 minute left in this meeting. The other link will be shared accordingly, and I request you
okay,
to
sir.
join. Okay, sir. And
Okay, sir.
70% of the students are sitting in the class with a single link, and others are 30% are joining
On the phone.
on their phone. So you can see the participants over here. So in the class there are
Okay, sir.
70% of the students. So I request you all to join. The meeting will end now within few seconds, and another link will be shared accordingly. So kindly join you all.
ओके सर शेअर लिंक शेअर केले सरांनी मला मी जॉईन करतो तिकडे आता
हो चालेल. ओके. थँक्यू.
Recording.
एक 2च मिनटं मला ते पूर्ण होऊ दे.